like to discuss intramuscular injections in the horse, a little bit about vaccines, and look at sites that we can utilize for intramuscular injections in the horse. So to start off with, when we talk about vaccines, there are a host of vaccines that we utilize in horses. Some of those we term as core vaccines, which are things like tetanus, Eastern equine encephalitis, Western equine encephalitis, West Nile virus, and rabies. And we call those core vaccines because almost all horses should be vaccinated for those. There are other vaccines that we call risk-based vaccines, and those are things like influenza, rhinopneumonitis, strangles, so forth. Those you should work with your veterinarian, look at what your horses are used for, where they reside, and then determine if your horse would benefit from those particular vaccines. But even if you utilize your veterinarian to do those basic healthcare things for you, I think any horse owner should be familiar with how to administer an intramuscular vaccine. There will be some time, regardless of the reason, where you may need to administer either a vaccine or an antibiotic to your horse through the intramuscular route. All right, so let's look at some different size needles, a syringe that we can utilize to give equine vaccines. Some of your individually packaged vaccines, if you order them from a mail order catalog or whatever, they will come with a syringe and with a 20 gauge needle. But if you're buying it in a bulk tank or your veterinarian is giving it out to you, usually we use a 3cc syringe. It's a fairly small syringe, but most of our vaccines will be a 1cc dose. There are a few, like some of the rabies, will be a 2cc dose. Hence, we normally use a 1.5 inch 20 gauge needle to administer vaccines to horses. We're not going to actually inject this mare today. There's no reason to poke her. I think we can demonstrate the site sufficiently without actually sticking a needle in her. So we've talked about vaccination up here in the neck and the landmark we can use. So let's say we're giving antibiotics, and if that antibiotic course is going to be a week to 10 days, maybe twice a day, that's a lot of shots. And sometimes that's what causes horses to become needle shy. So what we're going to have to do, because we're giving usually large volumes of antibiotics for many of these, especially penicillin, we may be giving an adult horse 20 cc's of penicillin. We don't want to give over 10 cc's at a site because it's more apt to cause some muscle necrosis, and it cuts down on the absorptive rate of the antibiotic because it's all in one big pool in that muscle. Next muscle masses that are the largest and the ones we tend to utilize next are down here on the thigh. You can see hopefully under this stalk, this big muscle protruding right here. That's a semimembranosus, semitendinosus muscle, kind of the back of your thigh here. A good site for an injection. The problem back here, as you've probably already realized, she's moving around quite a bit. We're a little bit in harm's way back here when we inject this horse. Some of them, you'll stick them, they'll never move, and you can do your injections. Other horses, as soon as you stick them, they're going to kick. So if we're doing antibiotics over multiple days, we're probably going to be forced to use these back legs, and hopefully we'll kind of be familiar with that horse and we'll know how we're going to deal with it. Bad one, we probably do want them in the stock, so hopefully they're not going to hurt themselves or hurt us. So that's the next big mass of muscles. You can even give vaccines back there if you know a horse gets really muscle sore in the neck, but again, vaccines we usually use the neck. You'll have some people talk about giving injections up here in the top of the hip or the croup. That's a huge muscle mass, your gluteal muscles, but if we happen to get a vaccine site infection and development of an abscess, that's a very hard place to treat. Gravity is not our friend there because it can't drain. An infection down here or even an infection on the neck, gravity is our friend. It'll help the drainage, and we can medically manage that abscess a lot better. An abscess up here is very slow to heal and causes a lot of problems. We try to avoid these muscles, but on long-term antibiotic care, we may have to use these. And most of the time, you don't get an abscess formation, but we try to avoid them if we can. So we'd use the neck, we'd use this muscle, we'd move to the left side of the horse, use that thigh muscle, and then we'd move back to the left side of the neck, and we'd just keep going around till we've finished our antibiotics. And hopefully the horse doesn't get to where they don't even want you to come next to them because it's not pleasant for them. I think with a little practice, any horse owner can give a proper intramuscular injection, and I think all of you should be familiar with doing it, even though you utilize your veterinarian most of the time for those services. So again, discuss with your veterinarian the vaccines that your horse may need, and if you need other advice on how to do it, I'm sure your veterinarian can help you with that.